This is your COVID-19 weekly briefing for Friday, April 17th. The Poconos continues to show its emergency preparedness and ability to help each other through this crisis. A patient who battled the virus, able to go home after being treated for severe symptoms.
Everyone you see behind me are the true unsung heroes.
This week, we learn from the experts how to use masks and why not to wear gloves. And we find out what to do if you're dealing with health issues unrelated to COVID-19. And get an update from county leaders on what's being done to flatten the curve and help those who need it.
Good morning, everyone. Thank you for joining us live online and on air for this COVID-19 weekly briefing. I'm Chris Barrett for the COVID-19 briefing team. Shortly, we'll be joined by healthcare leaders in the Poconos, as well as some useful information for everyone regarding the best ways we can help slow the spread of the coronavirus and save lives. We want to thank Blue Ridge Cable TV13, East Stroudsburg University, and everyone helping to provide the public with important information. Please remember, you can get up-to-date information at our website, poconomountains.com/COVID-19. First, some good news. The Pocono Television Network was there this week as the first patient to be put on a ventilator was released from Lehigh Valley Hospital, Pocono. Stephen Abdo of Tobyhanna was on that ventilator for 5 days and is now continuing his recovery after receiving life-saving treatment.
It brought tears to my eyes, to my heart, my soul. It's truly wonderful. Everyone you see behind me are the true unsung heroes that go through it every single minute of every single day.
You can find out more about this success story on the Pocono Television Network and online on YouTube at Pocono Tourism and at PoconoMountains.com. Meanwhile, state health officials have set up a temporary hospital at Kohler Fieldhouse here on the campus of East Stroudsburg University as a precaution with 200 hospital beds in the event this is needed to care for patients. St. Luke Hospital Monroe campus, as well as Lehigh Valley Hospital Pocono, continue to see patients, and their respective presidents will speak in just a moment. First, we'd like to give you some numbers. Last week, we had put a dashboard up as a baseline to start to look at how the Pocono Mountains is affected by COVID-19. The first slide compares this week to last week in cases and, unfortunately, fatalities. In total, from 5/9/20 through 5/16, and this data is sourced from the PA Department of Health, 1,011 cases were noted. The change in cases week over week was 25%. Unfortunately, the change in fatalities was 38%. Monroe County last week had approximately 71% of the case totals and 71% of the fatalities. This week, it has reduced slightly at 65.83% of the case totals and 65.9% of the fatalities. The Pocono Mountains last week was 5.54% of the case totals within Pennsylvania. This week, it's 4.91%. The next slide shows graphically how we look this week. The next slide shows age ranges of cases to date, and you can see most are over the 25, level 2, 65 plus. The next slide shows the hospitalizations as to age. The final slide shows the number of cases and unfortunate fatalities in Pennsylvania and the amount of folks who have tested negative as of 4/16/20. Again, this information is at PoconoMountains.com/COVID-19. Right now, I want to welcome Lehigh Valley Hospital Pocono President Elizabeth Wise to speak about the latest healthcare updates and tips for the public on face masks and gloves. Elizabeth, thanks for being with us.
Good morning, Chris, and thank you for the opportunity from Pocono Mountains Visitor Bureau to participate in this, as well as I'd like to thank Don Seipel, the president of St. Luke's Monroe campus, for collaborating with me on this presentation today. Before I begin, I'd like to send out my sympathies to all of those in the county and the state and the country that have lost their lives. I received an email from one of the nurses who had the opportunity to hold a patient's hand while he passed away at our organization, and his daughter was there to comfort him with words. And the information that I received from the nurse was not only was it very emotional for her to participate in this, but it was also very rewarding that she had the opportunity to do this with a patient at their last moments. I'd also like to update you related to what's happening at the hospital. We are seeing a slight decline in the number of patients that are in our intensive care unit, particularly those that require a breathing tube and a ventilator to support their life. But we are still seeing steady volume in terms of our number of patients that we are seeing on our medical surgical floors, as well as our cardiac monitoring areas. We were thrilled today to be able to, the other day, participate in a fond farewell for one of our patients that was on the breathing machine. We had over 100 colleagues clapping, and the highlight of it was when the patient got to see his spouse for the first time in several weeks and to hug him and welcome him back home. We also played a song of U2, It's a Beautiful Day, and we will continue to play those songs for patients that we discharge to home and out of the organization. I will tell you one of the things that we're doing, and I've talked to Don about this as well, is a procedure called proning, where we place a patient on their belly for about 16 hours a day in a swimmer's-like position, and that has been known to help improve the breathing of patients, and we believe that with our other treatment modalities, following what the early evidence shows us, is leading to some of these successes where patients can go home. But that being said, I will tell you it takes a team. So not only our doctors, our nurses, but we've trained our physical therapists and other team members in this proning. It's easy for patients who are on the floor to prone, but for those in the intensive care unit, we must be careful in terms of their breathing tube that's in, as well as the IVs, and prone them safely and carefully. And so we have teams that have been educated on this proning. And Don will also highlight this as well as his organization, because we've discussed that we're both doing the same things in our organization, which is a good thing. We're providing safe care. So what I'd like to do is transition and talk to you about the importance of personal protective equipment. So as clinicians, we know how to put on and take off equipment. But for you at home, when you're being asked by the governor now to wear a face mask, or you may be wearing gloves, there's a way that you put it on and put it off. We call it donning, putting on, and doffing, taking off. So this week, we want to highlight the importance of wearing face masks to help slow the spread of the virus. Many people incorrectly believe that gloves can prevent the spread. As Jim Hamill of Pocono Television Network explains, Lehigh Valley Health Network officials on the front line urge everyone to follow these simple steps to stay safe.
From the front lines here at Lehigh Valley Hospital Pocono to the essentials like the grocery stores, face masks are now being used to help slow the spread of the coronavirus. The experts, including Jennifer and Ashley, nurses at the hospital in East Stroudsburg, want to set the record straight on proper mask use.
For the general public, they recommend that you just wear a cloth mask. And for healthcare workers, we have two different types of masks. We have a surgical mask and we have an N95 respirator. And depending on the type of care that the patient is receiving will depend on what mask that healthcare worker should be wearing.
These nurses have become accustomed to wearing personal protective equipment, or PPE, while they help treat patients battling COVID-19. Both the Centers for Disease Control and Pennsylvania health officials suggest face masks can help flatten the curve and save lives.
So the mask is supposed to cover your nose and your mouth, and if you were to accidentally sneeze or cough or even talk to somebody else in public, it kind of keeps all of your secretions contained so that you're not exposing somebody else to your secretions.
These nurses want to remind everyone the N95 masks should be reserved for healthcare workers only. And if you are wearing a cloth mask, there are some simple tips for using it properly.
You want to hold it by the ear loops and put it on your face. And you want to make sure that it's covering your nose and your mouth at all times. Once it's on, you don't want to touch it with your hands. If you need to adjust it, when you're done, you want to wash your hands or sanitize them.
Then put the mask in the washing machine. Another tip from the pros, gloves are not recommended as healthcare experts say they provide a false sense of security. Ashley demonstrated it for us using red paint to signify how the virus can spread even with gloves.
Show you, you go to the grocery store, you go to the produce section, you pick up a banana. Pick up the banana, you kind of look at the banana, kind of like, oh yeah, you know, this is a good looking banana. You put it down. Then all of a sudden you kind of get a phone or a text. Your phone's in your pocket. You reach into your pocket, pull your phone out, and you're texted.
Because the gloves aren't helpful to prevent the spread, these healthcare providers stress the need to wash your hands and use sanitizer rather than gloves.
Next thing you know, like as you can see, now I am covered potentially in the virus without even realizing that I've contracted it, and I'm wearing gloves. There's no difference between wearing gloves or not wearing gloves. The biggest thing that we recommend is wash your hands and sanitize your hands.
And if you must go to the store or pharmacy, these experts suggest going when there are fewer people out in public, like the evening or early mornings. All simple steps we can take to help flatten the curve and save lives. Jim Hamill with the Pocono Television Network in East Stroudsburg.
Thank you, Elizabeth, for everything that you and your staff are doing to keep us safe and save lives, and also keeping us healthy. If you want to see more, please visit our website at the Pocono Television Network on channel 734. Now we'd like to welcome Don Seipel, president of St. Luke's Hospital Monroe Campus. Don.
Yeah, I just want to take a moment and say thank you, Elizabeth. She and I both agree. We've been seeing very similar experiences with the COVID patients here in Monroe County, and you know, it's been pretty interesting and pretty challenging to see how this has progressed. But good morning. I wanted to provide an update this morning on based on what we've been seeing here at St. Luke's. The measures we have taken in the community have certainly worked to flatten the curve. Although we can't claim victory yet, we're seeing positive signs. We need to continue to be vigilant about social distancing, self-quarantining, and masking. Some of the positive signs we have seen are many more patients are coming off ventilators successfully and being discharged. The St. Luke's Monroe campus has discharged over 70 COVID patients, and as a network, we have discharged over 450 COVID patients who have recovered or are on the road to recovery. Among those discharged patients, many who were on ventilators have come off. As a network, we have had over 50 patients successfully come off a ventilator. The emergency department is still seeing primarily COVID patients, but we are seeing more patients non-COVID patients seek care appropriately in the emergency department. We continue to develop and refine treatment protocols that are promising. One example is the use of experimental blood plasma. Plasma from a person who has recovered from COVID-19 contains antibodies that may provide a powerful boost to someone else fighting this viral infection. We have successfully used this therapy with one of our patients at our Warren campus. The treatment is part of a national expanded access therapy protocol overseen by the Mayo Clinic. Candidates can contact Liz Navarre at our St. Luke's Pulmonary Critical Care Associates at 484-503-0350. Again, candidates who want to donate can contact Liz at 484-503-0350. We want to stress the importance of non-COVID patients managing their health. They should utilize their primary care provider, televisits, video visits, our Care Now, and the emergency department. I want to assure you that if needed, the emergency department is a safe place for non-COVID patients. As Brianna Strunk of the Pocono Television Network explains, doctors with St. Luke's want patients to continue to seek medical treatment, just in a different way.
So tell me, how are your sugars doing?
This is what a virtual visit is like.
This is not something that we were doing routinely in the past.
But lately, it's become the new norm between doctors and patients.
I completely understand patients' reluctance to do something that's new. In fact, nobody likes change. However, I will tell you that this has been a learning experience for physicians and providers like myself, and we have become quite creative in how to do exams and how to obtain data from patients at home.
Dr. John Brinker practices family medicine with St. Luke's University Health Network. He says it's important to continue seeing your doctor for routine care, even if it's from home through a computer or cell phone screen.
Your conditions aren't taking a break because we're in the midst of a pandemic.
And Dr. Brinker says virtual visits are effective. With some assistance, patients may be asked to weigh themselves and take their own temperatures.
Patients can show me rashes with their iPhones. Patients can show me what their throat looks like.
However, traditional care is still available when needed.
Rest be assured that whether you're presenting to the office or you're presenting to the emergency room, we are taking every precaution necessary to protect both ourselves and our patients.
That protection includes having patients call the office when they arrive and waiting in their vehicle until an exam room is available.
We are trying to avoid having too many people in one area.
Maintaining the same level of care, just using a different approach. For Pocono Television Network, I'm Brianna Strunk.
Thank you, Dawn and Elizabeth, for some of the great cooperation between our health systems. I think we're truly fortunate in this community to have our major health systems cooperating together in this time of crisis, which brings comfort to all of us. So please heed their advice, and remember, we are not around the corner yet, so we need to do everything we can to help them and those first providers, those frontline folks who are risking their lives daily. Now we'd like to take a look at some local updates for 2 of the 4 counties that make up the Pocono Mountains. Next week, we'll hear from Monroe and Wayne counties. This week, Pike and Carbon County commissioners provided a look at what's being done to address public health concerns and provide relief to those who need it.
Hi, I'm Matt Osterberg, Chairman of the Pike County Commissioners here in Milford, Pennsylvania. This week in Pike County, the administration building has restricted our hours of operation from 8:30 to 12:30. That is by appointment only. We are asking residents to please call the offices first before they proceed to attend anything here in the administration building. We are also asking that if you do come here for an appointment, that you please wear a mask, and we are having our employees also wear masks when they're interacting with the general public as people enter the building. So we wish everybody health, and all of us together, social distancing and doing the following the CDC guidelines and the Department of Health, we will all be much better off in a couple of weeks, and we can move on with our lives. So thank you. Be healthy.
Well, I'm Wayne Notesine, Carbon County Commissioner, Chairman. We're at a difficult time in our history of Carbon County and the Commonwealth, as well as our country, with the COVID-19. Carbon County has a low number simply because our population is a lot smaller than the surrounding counties. For additional information, residents or visitors can go to Carbon County website and get additional information or links such as the Carbon County Chamber to see what businesses are open or doing businesses, takeout businesses, etc. We're more than happy to help anyone that we can throughout this crisis. We'll be working with our businesses to try to get them back up and running as soon as possible. So please be safe out there and take all necessary precautions.
You're watching the COVID-19 weekly briefing here on the campus of East Stroudsburg University, brought to you by the Pocono Television Network and Blue Ridge Cable TV13. You can also watch this live streaming on YouTube and afterward on the Pocono Mountains, PoconoMountains.com/COVID-19. We'll be back next week with more guests and more updates for you. Next week, we'll be back with some folks from the United Way and the Chamber to talk about some different issues that relate to all of us. So we hope that you'll be able to tune in. We'll have more information during the week at the website I just noted. Finally, we would like to take a moment to salute all of the heroes working at the front lines, silently, whether that is the checkout at your local grocery store, the bank, or the selfless healthcare workers that are risking their lives daily to keep all of us healthy. Even in times of great difficulty, we in the Pocono Mountains can see how dedicated everyone is to this community and to the health of its residents. We are grateful for each and every one. I'm Chris Barrett. Thanks for watching.
Thank you guys again, everybody.
Help is just a click away. Visit PoconoMountains.com/COVID-19. That's PoconoMountains.com/COVID-19.